Good morning. Welcome to the Family Readiness Resource Center's presentation on Let's Talk About Grief. And we are so thankful to have you all joining us here today. And we just wanted to introduce our presenter. It is Gemma Stratton. She is a licensed clinical social worker and pediatric oncology therapist with the Innova Life and Cancer program. She obtained her bachelor's in social work from James Madison University and her master's in social work from the University of Washington, with a specialization in healthcare practice. At Life with Cancer, Gemma provides therapeutic support to children, adolescents, and families impacted by cancer. Gemma's clinical focus includes adjustments to diagnosis, child development, and pediatric bereavement. Currently, in addition to community outreach, Gemma also hosts LWC Teens Connect events and facilitates for both the Life with Cancer Grief Circle and Curious About Cancer program. Again, Gemma, thank you so much for being here today and for all you do for this community.
Thank you, Erica, for that introduction, and welcome everyone to this topic. Before I begin, I really want to acknowledge that I know talking about grief and this topic around bereavement can be difficult depending on your lived experience. And so I want you to be mindful of your own needs and take a break if needed. If there's any topic that just feels a little bit too much for this moment, again, this will be recorded and it'll be a resource that you can look back on when able to. I will be using words such as death and dying during this presentation. And while that might feel blunt at times, I really want to model the clear language and communication that we really want to be using when talking about grief and loss, especially with children. And so here's a bit of a summary of the information that we'll be talking about today. I'll include an introduction just about loss and what is grief and bereavement and all these words that you might hear. We'll have a section about what to say. So if that's a big question on your mind, how do I even talk about this? How do I get the words to say? We'll cover that and provide some language recommendations that you can use. We will be covering developmental information across ages, including some specific strategies that are specific to certain age groups. While there may be some information that will be specific to one age group over another, I will say that a lot of what I'm going to talk about today is applicable across all ages. Really, there's a lot of this foundational skills in talking about grief and loss that no matter the age of your child can be really helpful. We'll go through some support and resources. So while, of course, I could do many different presentations highlighting specific situations and nuances that go into having someone in your life or your community die and grieving those losses. We're going to keep it pretty general today, just so I can cover those foundational skills around this topic, but I will have resources and places you can look to further for further information. And so as Erica mentioned, we will have that Q&A portion. And of course, I really want to keep everyone's information and story protected. So when we do get to that point, if you can keep your questions relatively general without too many of your own personal details, just so that your story can be protected, that would be recommended. And lastly, while my particular background in grief and bereavement is in situations following advanced illness, I will be talking about grief and loss, generally applicable to many different loss situations. And so I will touch on some other specific types of losses, which will include death by suicide. And so I really want you all to know that when we get to that point, I will provide a warning that we're getting to that section, just in case you would like to be prepared. So kind of starting with this introduction, what is loss? I like to start with this because grief can occur after many different types of events, not just the death of someone that we love. These losses can sometimes be called ambiguous losses. These losses that, when we think of grief, we think of that feeling of having someone in our life die, but there's many other situations where those grieving reactions can happen. That sometimes we don't get the time to say, wow, this has actually been really hard and this has been a grief experience for me. And so, of course, loss can include the death of a loved one or community member, but it can also include a separation of any kind: deportation, incarceration, divorce, being separated from a family member or a loved one. And so, children and adolescents can also experience grief in these situations. There can be changes in social relationships. That can be maybe a child has moved away from their home community. Maybe they've had their best friend move away from them. Sometimes there's those natural transitions that happen for children and adults alike, where certain friendships come and go, and there can be grieving that happens there. There's changes in capacity or ability. So maybe not being able to participate in an activity that you used to enjoy. So this could be an example of a teenager who had an injury and loved to play soccer but can't play anymore. There can be grief there of the sport that they love to attend, the games they wanted to participate in, maybe future aspirations within that sport. And something that has been added to this presentation that used to not be here was the pandemic. And that's because it created a very unique community experience of loss, whether that be the loss of loved ones in the community, but also loss of experiences during those years that children couldn't participate in the same social interactions that they were used to. They couldn't participate in school. There is some grief that children and adults alike have experienced from the pandemic. And I also like to touch on national events can cause grief in communities as well. In the news, children might hear about tragedies occurring in schools or communities nearby or communities even miles away. And hearing about those can cause those worries and maybe upset feelings and can result in grief as well. So I just talk about this for the point of acknowledging that some of what we're going to talk about today, you might say, I've actually noticed that in my child before, maybe from a different situation that did not involve death, and maybe we didn't think of it as grieving at the time. So children may experience a number of losses in their lives, and they can be very varied and different from one another. And sometimes, although it can be easy to think of children as just mini adults, they really do mourn differently than we do. And that has a lot to do with how their brain develops over time. So even within the ages from birth to early adulthood, so much is happening in the brain that helps a person and a child learn and understand things like death and loss. And so how a child may experience, understand, and cope with their loss will depend on a few factors. Like I just mentioned, developmental stage is a huge one. So the way that you'll talk to a 4-year-old is going to be different than a 17-year-old. Their past experience with loss is going to be really important too. Is this the first time they're grieving? Do they have a benchmark or a baseline of what this experience feels like? Maybe if they've lost another loved one before, they might associate this experience. They might already know what to expect, but that also might bring up some other feelings for them. So just being aware of that. Individual temperament. If your child is already prone to emotional expression, some of that might be easier for them during their grieving period. Or if a child is a little bit more internalized and doesn't verbally express their emotions very much, that might not change during their grieving period. Family factors, of course. If the loss happened, is it the whole family grieving? Who's in the family? What is the other family members' experience with loss? Do they have supportive family members nearby? And then, of course, culture and religion will definitely be incorporated into a child's ability to process their loss. That faith and belief system will help inform how they understand what's happening, as well as the language they might use or what the family might use. And if there's anything I'd want you to walk away from this presentation knowing and understanding, is that grief is a normative process. Grief is a part of the human experience. No one is untouched from facing a loss in their life. Although when they have that first loss might be dependent on each person's situation, eventually grief will be something that everyone experiences. And it's something that as a community, we can relate on with each other. And talking about grief and death can feel really intimidating. So sometimes we want to push it away or not talk about it. But there really is no wrong or right way to grieve. And I also add here that not every child will need professional treatment. Grief is going to be hard and difficult for everyone in their own unique way. And sometimes that's the part of that process we really want to enforce that's a normal human experience. I will get into this presentation later, signs to look out for if your child does need that level of professional treatment. But I want to provide that reassurance that many children and adolescents, with the support of the relationships they already have in their lives, can do really well through their grieving experience. It doesn't take away how hard it is, but they can cope and process with their family and their relationships that are already existing. Grief is individual, so every child will be different, even if it's the same loss that a group of children or maybe siblings are grieving. The way in which they may grieve will look different from one another. And grief is a roller coaster. It's ups and it's downs. And so reactions to a loss may change and fluctuate over time, day by day, week by week, month by month. Children can experience something that we call re-grieving. And this is basically how, as a child develops through different ages, milestones, so will their understanding of death and their loss. So if the loss happened when they were much younger, maybe 4 years old, when they get to 13, 15, 16, they may experience this re-grieving, almost like they're grieving anew. And it's really just because as their brain has developed, more things will click and they'll understand things different and they'll process things differently. And so sometimes those grieving behaviors that maybe you saw really early on, or maybe you didn't see early on, and then all of a sudden it'll feel like it just happened again, is not uncommon to see with children. So symptoms and behaviors come and go. And some days will be better than others, and there'll be moments of laughter and levity and happiness. There won't be all the days that feel really dark and heavy. And so we're going to transition to the what do I say? What kind of language do we use? And so while, of course, I've touched on there's lots of types of losses, we are going to focus on the situation where someone has died for this presentation. And so we're going to start with this what do I say question. And cover how to prepare for not only that initial conversation, if you're in a situation where you're telling a child that someone has died, but things to keep in mind as you talk about death and grief moving forward. So with setting the stage, preparing yourself is always step number one. When you are telling a child about someone they know who has died, there's a significant chance that you are grieving too. And that's really important to acknowledge. And so before having this conversation, giving yourself a moment, and depending on the situation, this might have to be a brief moment. Maybe you'll have more time, it depends. But having that moment just to process and acknowledge your own feelings. If you find yourself emotional having these conversations, I really want to emphasize that is okay. It's okay to show emotion. Sometimes feedback I hear from parents, I don't want to cry in front of them. I'm worried I'm going to cry when I'm telling them, and that will worry them. And while we do want you to be able to share the information in a way that can be understood and can be articulated, being tearful or emotional during these conversations is okay. It's normal. And in fact, will model for your child that it's okay if they were to react that way too. It's okay to show how to express their emotions, and everyone will have a different reaction. We want to be able to choose a time and setting that feels appropriate. And so I'll tell you some things that I recommend to keep in mind. We do recommend telling the child as soon as possible. Of course, with taking some time to acknowledge your own feelings, but we do want the child to know relatively soon after. And that's for mostly so that they don't find out by accident. They don't find out in a setting that might feel like one that's not safe for them to react the way that they really want to. And we also don't want the child to feel like it's been kept from them. And so relatively quickly, after you've been able to think about what you want to share and process some of those emotions yourself, we would want to encourage sharing that with the child. We want to pick a space that is safe and comforting with few distractions. They're not rushing off to go somewhere right afterwards. It can be really tempting to try to bring the child to a favorite place or incorporate something that they really enjoy in the moment that you're telling them as a way to soften the blow or make them feel better. But we really recommend picking a very neutral, safe, comforting environment like home. Um, and that way, they don't have to associate this bad news with maybe like going to their favorite place or their favorite thing. That can be something you can offer to your child afterwards as a way to cope and handle and redirect some of their emotions if they want to do something like that. But for the moment that you're telling them, you really want to keep that space somewhere neutral, safe, comforting. It's also important because that way the child can feel comfortable reacting however they want to react. And we'll go into what those reactions can look like, but whether it's crying, whether it's, keeping a pretty neutral face, they want to be able to feel that they can react whichever way and not have pressures from other people being around or being in a setting that they might not feel comfortable to do so. And of course, considering those past experiences with loss. How have they reacted before? If they've lost a loved one before, what did that look like for them? If this step happened from a different cause, just being aware that you might have to do some additional explanation or there might be some confusion or questions around that. So when you're starting this conversation, we're going to start simple, no matter the age. You can always add details slowly in increments when the child is ready. So we're going to start with just telling what happened in simple details. And we want to use the words like dead and died when having this, especially this initial conversation, and especially if the child is young. And this is really to give the children and adolescents vocabulary and make it very clear what happened. We want to avoid unclear language. And this can look like many different things. And I'm sure you've heard before a lot of these different sayings and euphemisms. We want to avoid these because they can be unclear, especially for younger children, and can lead to maybe some misunderstandings of what actually happened. So really common ones we hear all the time are, grandma passed away, or it was time for your aunt to move on. It feels like we're softening the blow, but for younger children, then it can bring up questions like, what does that mean? If my aunt left us, why did she leave us? When is she coming back? If maybe they've gone through the death of a family pet and you're like, oh, they're going to be sleeping forever. It feels like we're softening that blow, but then it might result in these worries and questions around, well, I go to sleep every night. If I go to sleep, will I not wake up or will I sleep forever too? And can lead to some additional anxieties. And so while it may feel blunt and uncomfortable to use words like dead and died with children, what it does is provide that clear vocabulary so that miscommunication and additional anxiety doesn't have to occur. Depending on your cultural or faith background, there may be beliefs and other language you would like to incorporate in these conversations, which of course is okay. What I recommend is pairing those statements and that language centered around your cultural and religious beliefs with this concrete language at the same time. It can look very, depending on what those beliefs are. But an example might be your aunt died this morning. Her body is no longer working, and so she's not here anymore. Her soul is now in heaven, but we won't be able to talk to her or be with her the way that we used to. So you can refer to some of those religious beliefs while also making it clear that the situation using that concrete language like death and died. So there's going to probably be questions. So allowing that. Children and teens may have questions and they may not have any. It really depends on your child, and either one is fine. There's no wrong way for them to navigate that. Some children just need more time to process. Some children will have those questions right up front, and sometimes that has to do with their temperament. And we want to continue keeping that language consistent and simple. So we want to have honest answers. I often tell parents that if a child's ready to ask the question, they've been able to think about the question, formulate the question, and ask it, they're probably ready to hear an answer. So we do want to provide honest and simple answers, but also you can just answer the question that's asked and try not to go into more information that they didn't necessarily come looking for. And as you might have heard in the previous example I just used, it can be a good idea to refer to biological explanations. So what that means is referring to the biological state of death. This not only works well with younger kids who may have a lot of why questions. For those of you who have had kids at that age or currently have kids that are young, they can ask why constantly and just on top of each other. And so all of a sudden, those questions can feel very overwhelming to answer in these situations. But it also makes it simpler for you as an adult to answer the questions. It gives you something concrete to go back to when maybe you're not even sure what the answer might be. And I'll give some examples of what this looks like. So maybe you get the question, when will she come back? Well, when will my aunt come back? The answer can be, she can't. She didn't leave, her body stopped working. So kind of referring back to when a person dies, their body stops working. When they ask those questions, why, kind of you can refer, if it was due to an illness or because of the illness, the heart wasn't able to beat the way that it needs to in order for the body to keep working. Maybe the question is he sleeping? Especially if they see the person or during a funeral memorial service, is he sleeping? And the answer could be, no, when we sleep, our body is still working. Our heart is still beating, our lungs are still breathing. And so kind of highlighting the difference that and going back to that biological explanation. Again, it just makes it simpler for you to provide the answer, as well as, especially with younger kids, giving them a really concrete map of what's going on. During these conversations, you're going to want to tell them what to expect. And this section, I'm going to give some options and things to think about when you're thinking of what should they expect. But of course, this is going to be really dependent on each family's traditions and culture and what practices you engage in after someone has died. So will there be a funeral or a memorial? Maybe a celebration of life? So what kind of ceremonies might they expect? Will there be a wake or a visitation? Will a casket, if there will be one, will it be closed or open? This is something to just prepare them for ahead of time, let them know what they might see, what to expect. Will there be cremation or burial? And what do those words mean, and what might that look like? And who might attend and what they might see? And this will there be a lot of people, and you're going to see a ton of people, and some of them you will not know, but there will be some people that you do know. Or this first ceremony or service is going to be just close family, but a couple months we'll have a much bigger party to celebrate our person. So just letting them know, who can they expect to see, especially if there's some familiar faces, you can let them know so-and-so will be here and they'll be able to support you. It can be helpful in these conversations to use visuals. While this can be most helpful for younger kids, I think for older kids it can be helpful too, especially because you might have a teenager who's never experienced the loss of a person or hasn't known anyone that has either. And so they might also be a little bit nervous about what these different services and traditions might entail. So as an example, we have like a picture of a casket there. So if there is going to be a closed casket or an open casket kind of showing, this is kind of what the casket will look like during this service. We'll be able to see our loved one inside. They're going to look like they're sleeping, but they're not. Their body's not working. Their heart's not beating, their lungs not breathing, but their body's going to be there. And so letting them know that's something they'll see. Maybe it's a closed casket. So we have that top down and we won't be able to see them, but their body will be in there and we'll be able to see them be buried or whatever the service might entail. Maybe if it's a cremation, that might be a new concept for some kids, showing them some examples of what that might look like as far as, will there be an urn? Will they be interred somewhere? Will they sprinkle the ashes at a location? We have a picture of a candle lighting ceremony, but that's really to symbolize if there's any specific traditions within your faith or cultural background, or just within your family's culture that might happen. Certain clothing to be worn, certain candle lighting, or different rituals or ceremonies. Providing some images and visuals if they haven't experienced that before can be really helpful. We want to provide choices when we can, and this can look like many different things. No matter the age of the child, it is recommended to engage with them in some conversation about what they'd like to be involved in and provide alternative options if possible. So this could be even as simple as, do you want to attend the funeral? Would you like a role in the memorial service? Would you like to say or write something to be shared? Is there anyone you would like to make sure was invited? That when there's a death of a loved one, it can make lots of people feel like they've lost control a little bit. And so this is a way to give that child or adolescent a little bit of that control back. Something I will emphasize here is only provide choices if you're okay, if the answer might be no. So if attending a funeral or memorial service or certain ceremony is an expectation within your family, that's okay. And that just means to redirect and focus on helping the child feel prepared for that. So if the answer, they do need to attend the service, okay. So it is really important that we all come to the funeral. There'll be lots of people there, but if you need a break, this is a code word you can share with me to let me know that you need to go outside, or this is a person that will be available to you if you needed to go and take a break from everything that's happening. So giving them some choices there still, even if that actual attendance to the service is required. So next, I'm going to get into some language recommendations. I only have a few, but they're both all going to highlight some language that can be used with all ages and just a way that some of these conversations can go. So in this first one, we have a situation that maybe a loved one has died from an illness. So this might go something like this. I have something to tell you. Grandpa has been very ill and he died this morning at the hospital. The doctors did everything they could to make him feel better, but his body couldn't work anymore. You won't be able to see him anymore, and I know you will miss him. Some things I want to point out here, letting them know you have important news, kind of simply saying, well, this is what happened, and using that concrete language, and providing that reassurance. The people did everything they could, but unfortunately, this still happened. It's no one's fault, kind of giving that reassurance. And then also letting them know that they can react or feel whatever emotions they may be feeling. So I know that you might miss him, and we're going to miss him too. This is a good snippet of just what this introduction to this information, this conversation can be. Of course, depending on the situation and your child, there might be follow-up questions. And again, you're just going to handle them as they come. So if they ask, well, what happened? What kind of illness? Sometimes in situations where there's illness, there's some preparation that happens. If a family member has been ill for a long time, the child might already have context of what's going on, or they might be aware of what's going on. So that's when you can fall back on previous information you have shared. If it's a very sudden illness, it's okay to also kind of just say, we don't really know what happened yet, but Grandpa had his heart started hurting and they found out that there was something wrong with his heart that was keeping it from beating the way that it needed to. So again, just referring back to that biological process. And so there might be situations where a death, like I was just mentioning, might be unexpected. And this language recommendation is with an example of a child who maybe a peer has died. And so in these situations especially, it's important to provide that reassurance that no one is at fault. And these kind of situations where there's been an unexpected death, especially of someone that's young or similar age to them, it can be really confusing, and it's okay to let them know that they might not understand and no one might understand really what happened. So in this example, I know it hurts a lot that John has died and you won't be able to see him anymore at school or around the neighborhood. He did nothing wrong and neither did you. Sometimes bad things happen and it can be really hard to understand. So acknowledging that confusion, that frustration that might be coming up, while also highlighting and using that clear language of like, you won't be able to see him at these settings that you were used to. That can open up doorways for you to engage. It's going to be hard to go to school and you're not going to be able to see him. What's maybe something we can think about that might help you in those moments when you miss him? So it can open up the conversation to talk about ways that you can support the child. In the next language recommendation that will appear on the screen will be a situation where there's been a death by suicide. So I just want to let you know about that in advance. So in situations where something tragic has happened, that may feel very overwhelming to explain to a child, especially if it's a brand new concept to them or something that they haven't heard a lot about. It's important to keep things even simpler and just focusing on as simple as possible. How can you break it down? Because again, you can build up from there as is appropriate for that child or that situation. So in this example, your cousin died because of something called suicide. Suicide is when a person does an action on purpose to make their body stop working and die. Sometimes a person's mind gets very sick and then they don't understand things clearly. So of course, there's a lot of nuance and further details that might feel appropriate to go into in these conversations. And that's really going to, again, depend on that specific situation, the relationship with the person, and what information you feel comfortable sharing. But what I really want to highlight here is it will be helpful to provide maybe a very basic or simple definition of this new concept or something that tragic that's happened so that they understand this word they might be hearing. And then being aware of other associations that the child might have. For older teens, they probably would be aware and have heard of suicide before. And so being sensitive to the fact that they'll have maybe other associations, and that might be coming up in these conversations as well. And of course, there's going to be some questions that you just won't know the answers to, or you just aren't prepared to answer. And that is okay. Saying I don't know is something that is actually can be helpful to model to children and adolescents, that there are some questions that we won't know the answer to, and not everyone will have the answer right away. So that might look like, I don't know the answer to that, but if and when I find out, I will let you know, or I don't know. And there are some things we might never find out. I know that can be confusing. I feel confused about it too. So highlighting it's frustrating to hear that I don't know answer. And that can be something that is an emotion that you can relate with each other on. Maybe I don't know that answer right now. Let me think about it and we can talk about it more later. So the I don't know response can also be if you get a question from your child about something that maybe was a tragic incident or something that was very sudden, and you haven't actually figured out how you want to share that information in detail yet, and they ask you a question, it's okay to say, I don't know how to talk about this yet. Let me think about it and I'll get back to you. It's okay to give yourself time so that way you don't feel pressure to give an answer that you haven't thought through how you want to share that with the child yet. So we're going to transition to talk a bit about specific considerations for different age groups. So much of the language recommendations we just touched on will apply throughout all ages, with the simpler language being used with younger children and with more details and nuance being incorporated with older kids. And so for infants and toddlers, so birth to 2 years old, when we think about their understanding of death, they don't have awareness of that concept yet. They're just learning language and just getting oriented to their world, which can be very self-centered at this age because that's what they're learning from. They're very focused on their caregivers. So there won't be a concept of death at all at this age. And there'll also be a very limited understanding of time and time passing. And however, infants and toddlers do have awareness of changes in their environment, their routine, as well as the actions, behaviors, and emotions of their caregivers. These children at this age are very in tune with the people who care for them and the things that they can learn to expect and rely on. Their whole world is really whatever their routine is. And so when there's changes to that, they can notice that and they can be responsive to it. So what you may notice, and so I'm going to be going into these potential observations you might have that are very normal and expected grieving reactions for these age groups. So for infants and toddlers, you might notice separation anxiety, especially if the primary caregiver was the one who died. They might be asking for that person, and they might continue to do that for a while because, again, their concept of time passing and their ability to retain and understand information might take a bit longer. But also just general and separation anxiety. If they're noticing their caregivers are distraught or grieving as well and things are different, they may want more of that attention and attachment. There might be changes in habits, so they're not eating or sleeping when they normally do. And there can be difficulty self-soothing. So increased tantrums, just increased irritability. They're needing a lot more of that hands-on attention to soothe. So how to help kind of early on, if you have a child at this age, is just meeting those increased attachment needs as much as possible. So a little bit extra eye contact, touching, rocking, just giving them those kind of physical sensory signals. You're here, you're being taken care of, I'm here, things like that. And then maintaining routine as much as possible. Of course, during a period of grief or loss, there will be things that might have to change, and that's okay. But if there's some things that can stay the same or consistent, that can be really helpful, just helping that infant or toddler kind of cope with these changes and have something they can rely on. So I'm going to go up to preschool, so ages 3 to 5. So at this age, children will understand that death is something that can happen, but they might see it as reversible or temporary, nothing maybe that serious. A lot of times at this age, their introduction has been through through movies, nature. So maybe they've seen an animal that's died by the side of the road. Maybe they've had a family pet die. And so there might have some discussions around what that is and what that means. And then famously, movies like Disney, they have lots of storylines that start with a parent or someone that has died. And so their concept of death might be really related to that, nature, movies, media that they might have consumed, but it might not feel very real to them. And so they have difficulty grasping that finality of death. Thinking at this age is very concrete and literal, very black and white, and which is why this is one of those ages where we really want to avoid those euphemisms, that unclear language like passed away, sleeping, left us, moved on, because at this age specifically, that can feel very confusing. They're going to take that very literally, and then that can turn into further confusion, further misunderstanding. And there's going to be some confusion between what is real and what is fantasy. So again, if they've only been really introduced through death, through movies, it'll be hard for them to understand what this means in a real situation like their own life. So what you might notice is regression. So regression is when a child may act younger than they are. This can look like thumb sucking, bedwetting, not completing tasks that they used to do independently. So maybe that's getting dressed, putting on shoes, picking up their toys, things that maybe they were starting to engage in independently, but all of a sudden they're not doing. There may be more short and intense emotional outbursts, these very overwhelmed feelings. We also see separation anxiety and difficulty sleeping or just changes to their sleep patterns. And also at this age, it's very common that children will play or act out the themes of death as they're learning about it. Children learn and explore new concepts through their play. And so sometimes families will notice a child maybe putting on a funeral with their toys, or they'll have one of their toys die, and that they'll draw pictures around death. And that can be very startling at first for some families. And so I like to encourage and reassure that that's a very normal way that this age group processes new information, and can be a really healthy way for them not only to explore it, but for you to engage in conversation with them about it. Also at this age, you might notice kind of what we call taking breaks from grieving. And really that's because at this age, the concept of time and is still developing. And so there might be periods of time where they act like nothing has ever happened, and they might need a lot of repetition to remember what has gone on, and that this person is no longer here. So there might be periods where they kind of take breaks from it. They don't engage in those conversations or those feelings of grief. And so how to help with this age group, really modeling, talking about emotions, especially if they're observing the emotions of others, explaining, mom's crying today because she really misses grandma and it's making her feel sad. Modeling that it's okay for them to express that too. Providing reassurance, they're not at fault, they will be cared for. Children can have something called magical thinking at this age, which basically they fill in gaps when they don't understand something. So it's not uncommon at this age for them to say, well, I was mean to grandma last week and now she's died. Kind of reminding them that that's not related, even though sometimes their brains might think that way. And then again, really focusing on that clear and concrete language and avoiding any softer ways to talk about it, just because it can end up being very confusing. So for school age kids, so this is around 6 to 11 years old, there is a lot of development that happens during these years. There are many different milestones that they hit as far as just understanding their worldview and the things happening around them, so which is why I have them kind of in two separate sections. So for children between 6 and 7, they're beginning to see death as final, but still might get very confused. So they may need a lot of repetition at this time to remember why they won't be seeing their loved one anymore, even though that concept that death is something that happens forever is starting to formulate. It just might need a lot of repetition. And they may start personifying death through player language. So talking about death as if they're a person is very common. We're on 7 to 11 years old. That's really when that understanding that death is permanent and irreversible will become much more concrete. And then around this age, they're going to start questioning their own mortality, because as they understand death more, they might ask questions like, well, what happens if that happens to me? What happens if that happens to mom? And they may be more concerned with details surrounding what happens when and after someone dies. So those questions about, well, where are they now? If they're dead and they're not here now, where are they? So you'll see more of those questions starting to come up. So what you may notice, and as you can see, there's going to be some similar behaviors that happen within this age group, like regression, which can be seen throughout this age range. And then behavioral and emotional changes are a consistent characteristic that we really see across all of ages. Something specific for 6 to 7 years old, again, is those repeated questions or requests for explanation. So what happened? What happened? Even though you've gone into it many times. And what you may notice for 7 to 11 years old, there's going to be an increased focus on social relationships. What will my friends think? My family's different now, or this is something that hasn't happened to my friends. So we see at this age, they actually get a little nervous telling other people. Sometimes there's a little feeling of embarrassment of this happened to my family, and I haven't seen this happen to another family before. The chances that they won't have many peers who have gone through a loss are higher at this age. And so some kids will really want to tell other people, and some kids will be really concerned about, well, will my school know? Will the class know? Will I have to tell everyone? Those types of questions will start coming up. And they may take on a helper role. This age, we see a lot of just wanting to help. They want to take care of their family members, and they don't want to see them upset. And so a little bit more initiative around just wanting to help other people. So how to help? Being open to answering questions, be prepared to repeat yourself, which I know can be painful if you're grieving yourself, but just being prepared that that might have to happen. Acknowledge the importance of peer relationships. There might be some people that you want to tell because maybe it's a family friend, the kids that your child is friends with another child, but you're friends with the parent. You want to share that, letting them know, I know this might be hard for you to let other people know right now. It's important for me to tell my friend, like, how would you like to approach that? And including them in those conversations, acknowledging that, I think it's important that we tell them, but would you like to be the one to tell them, or would you like me to do it? So again, giving those choices, even though there might be certain people that have to know about it, giving them some choices about how it's shared. So that way they still feel included. And then encouraging movement, art, and play for emotional expression can be really important as well. Sometimes that's more accessible than just expressing it verbally. So on to teenagers. So teens will have a pretty complete understanding of death and dying, very similar to adults. And they will also have a higher likelihood that they've experienced a loss, or at least witnessed a friend go through a loss. So there's going to be full awareness of death and mortality. There might be some of that survivor's guilt, or just those questions of why not me, especially if it was a death of someone in their community or a peer. But other than that, the understanding is going to be very similar to an adult's. So what you may notice, again, are those behavioral and emotional challenges or changes. They may confide more in their peers than family members. So those social relationships are still going to be really important. Often we hear parents say, well, they haven't talked about it with us. And then we talk to the teen and say, well, I talked about it with my friends. And that's really normal. That's just where they're looking to for that type of emotional support at this age. And there's going to be this balance between the desire to be independent and the desire to get support from others and needing that support. So teenagers often want to appear independent, and given that space away from the adults and saying, I can do this on my own too. However, this sometimes leads to teens not wanting to express their emotions and thoughts with their family members out of wanting to appear mature, or that they're able to handle this loss or this event without help. There's this false bravado, something to be aware of with teenagers, that even if they're acting like they're handling it really well and they're having this really mature approach to it, just being aware that that might not always be the case. More internally, they might be having a harder time than you may observe. And so, how to help, again, acknowledging the importance of peer relationships. If they are confiding in their friends as much as you want them to talk to you as well, being okay that that might be where they are at that time, including them in more conversations. At this age, they might want to feel more involved in the conversations around the loved one, the services that are happening after the loss, things that are leading up to the loss, if it is something that can be anticipated. And using just phrases like, I'm here when you need me. So acknowledging that I can see that you're doing pretty well, but I'm here when you need me. Opening up that door for them to feel comfortable sharing with you. So I've mentioned a lot of behavioral and emotional changes. So I did want to spend really quickly some time what those changes actually might look like in more detail. Some of these, when we get to the behavior slides, are some things that were on those specific age group slides, but just so you have an idea of what type of these changes that we can see that are pretty normal and expected of a grieving child. So unfortunately, it's not as simple as just having a list of like, this is exactly what a grieving child looks like. It really can include just about anything. And again, it's so dependent on those factors that we talked about in the beginning of this presentation. It can be sadness, it can be guilt, anger, fear, worry, confusion, shock. Those are things that I think we think of often when we think of grief. But emotional reactions can also be very neutral. A child can have no reaction, no at least observable reaction. And there can also be things like silliness and relief, which we don't always think about when we think about grief. Children can often resort to that kind of humorous or silly place, especially when something's new or uncomfortable. They notice that people are having a hard time with it. They might want to distract themselves by being silly. That's something that we can commonly see. And sometimes, especially if there's a loss that was anticipated, so maybe it was after a long illness or something like that, there can be sometimes feelings of relief that experience is not what they're going through anymore. And sometimes that can be startling, but it's very normal, and adults can feel that too. And so the behavioral reactions, some of these you'll recognize from the other slides. So I'll just kind of pinpoint some ones of note. Again, kind of what I was talking about with the silliness, there might be uncomfortable or inappropriate laughter. They might be silly at times that don't feel like they should be silly. And again, it's just they're uncomfortable and they're trying to distract or cope with that feeling. We can have some kids who really get clingy and want to be around their family or their preferred people often, while others might withdraw a bit as they're processing on their own. Of course, there might be some taking on adult responsibilities. There might be some responsibilities they have to take on due to the grieving period. And so just being aware, if you're noticing that maybe your middle school, high school aged kiddo is really trying to take on a lot of responsibilities, giving them that balance and opportunities to do more, age appropriate things as well. So they don't feel like they have to do that all the time, though that can be a way that they might be coping with the grief. We also might see a lack of interest in school, not really being able to focus. Sometimes grades will drop a little bit, especially right after the loss because they're missing school, they're just having trouble getting back into it. Some kids might avoid talking about the person who died. They don't know how to talk about the person who died. Again, I think a lot of times there's this instinct to not talk about grief, not talk about death, and that can come up for some kids as well. There could be an increased talking about death and dying. So again, it comes up maybe in play, but sometimes kids and teens will use expressions of wanting to die to be with the person they lost. And these are different than necessarily like suicidal ideation or suicidal thoughts or comments, just like, oh, well, I want to go to heaven so I can see dad again, or I want to die because that's what happened to my loved one. I want to see them. So they're different in that they're just expressions of wanting that connection, that relationship with the person that they lost. And there just might be more preoccupation with death. Just that's coming up a lot more often for them. And the last one I have on this list is for some kids, there'll be no noticeable changes. And so as much as I wish I could provide an exact roadmap of what you know and can rely on to expect, really the purpose of these slides was to enforce that you're going to see a lot of different things. You might see something that's not very noticeable. You might see some changes that you haven't seen in your child before. And that's can be a normal part of grief in that human experience that we talked about earlier. But what's next? So how do you support? So we've had the conversations, we're talking about it. What are some things that you can think about and do in the home and in the community to support these grieving children? Maintaining routine. So if the child loves going to soccer practice and loves being a part of art club, and those are things that they rely on, even if there's periods of time where they're like, oh, I'm kind of sad, encouraging the attendance to those activities and seeing their friends there and engaging in that space that they really enjoy can actually be really healing. It can be helpful to return to structure. Grief leads to a lot of feelings of lack of control. And so going back to structure and routine can be really helpful. Maintaining routine as far as school goes is really important too. For some families, depending on what they need, they may have the child take a couple of days off of school. I've also worked with families where the child has chosen to go back to school the day of, and there's no right or wrong there. I think taking the child's lead, but if possible, encouraging their return to school when it feels appropriate based on their situation, because school is somewhere they get structure, they get routine, and they can have a lot of comforts of the people around them and some healthy distraction too, which can be helpful than rather being at home where it might be hard for them to take a break. We really recommend letting the school know, and they can help you make a plan. This can look like talking with the school counselor, social worker, the principal, the teacher, highlighting who are some people my child feels comfortable with. So when they go back to school, these are people they can interact with and be with. Where can they go if they need a break? Making that plan of, okay, if something comes up in class that you're worried about or stressed about, or makes you think of your loved one and you need a moment, how do they ask for that? Some classes might have a pass, they just can show, they don't have to say anything, making that plan of what that might look like so they feel they might not need that plan, but at least they have it. And maybe do they need any alternative assignments? Do they need, if they're in elementary school and Mother's Day is coming up, do they need something else to do on that day? Some kids will say, no, I want to do the Mother's Day activities. And some might say, I'd like to do something else or be out of class that day. For high school students, maybe getting them some extensions on tests or big assignments when they're really in that first acute intense grieving period, that it might be hard for them to be attending school regularly. They might be missing school due to services, funerals, things like that. And encouraging connection with trusted non-parent adults. So if there's other adults that your child engages well with and can trust, it's helpful just to let them know, I know you really feel comfortable talking to our neighbor. If you want to talk to them about it, that's okay. Maybe a coach, a club sponsor, Girl Scout troop leader, Boy Scout troop leader, other adults. Sometimes it can feel intimidating for them to talk to their parents because their parents might be grieving too. And so letting them know here are some trusted adults that can also support you, that they can go to if they need to, and they might feel more comfortable doing that in some cases if it's hard for them to engage with family members who are also grieving. You really want to encourage bringing up their loved one in conversation and in day-to-day activities. Again, sometimes we don't want to upset people, so we don't bring them up. So don't be afraid to mention them and encourage others in your circle, your supportive community too as well. Even if it's just casually, like you're listening to the radio and you go, oh, mom loved this song, didn't she? Or if you're at a restaurant, you see this was grandpa's favorite. Like maybe I'm going to order that because I'm thinking of him. This gives a signal to the children that they can also bring up their loved one. If they notice no one ever brings up their loved one, they might not either, because they think, oh, maybe that's a rule. Maybe I shouldn't bring up my person. So by you doing it and modeling it and asking others to model it as well, opens that door for them. Discuss ways as a family and with the child that they'd like to remember and celebrate their person. There's a concept we talk about within grieving called continuing bonds, which is essentially connecting with the person who died and continuing that relationship with them, even though it's different. So just because they have died doesn't mean you don't talk about them. It doesn't necessarily mean you can't celebrate their birthday or incorporate them into holidays. It might look different, and each family is going to have different comfort. And that's really what I tell families. What about remembering your person? What activities, what topics make you feel comforted and bring comfort to you? That's going to look different. An example I can give is, I know a difficult transition for some families is having that empty spot at the dinner table. Maybe their loved one always sat in that seat, and it feels very hard, especially early on, to handle, what do we do with that seat? No one wants to sit in it. Do we still set it as we normally would? Do we leave it empty? I encourage families, if that's something that's causing a lot of distress at dinner, would it feel more comforting to decorate their loved one's chair? Put colors or charms or decorate it in a way with things that reminded them of their loved one? Do they want to get a special placemat that they can make together, or a special plate that they still set at that seat? That might not be something they do forever, but if that's going to bring comfort and allow that connection to continue and build during this really difficult time, that can be encouraged. And that's just an example. We don't have to try to rush and move on. We can find ways to celebrate and remember that person. And again, modeling that for children can be really helpful. And of course, being mindful of milestones, holidays, important dates. This can look like, just holidays and birthdays, but it can also look like things like the first day of school without their loved one, or the first time they meet a new friend, or they don't have their loved one in their life. That new friend can't meet their loved one. Graduation, prom, the first Mother's Day, the first Father's Day, things like that. And it could also include anniversaries of certain things that happened in that loved one's life. So, of course, maybe the death anniversary, or, if they were sick, they remember, I remember it was in the spring that mom started getting sick. So just being mindful that those are periods where you might see spikes in these behavior, in grieving, emotional reactions, and just being prepared, and sometimes opening up that open conversation of, hey, this period of time is going to be coming up. It might make us remember. And that's okay. Is there something you'd like to do during this time? Or would, if it's mom's birthday's coming up, maybe it feels better to do something not related to mom and just go do something relaxing, while some families might want to do something that celebrates that person. So just kind of seeing and including children in those discussions. So of course, while there are many emotional and behavioral changes to be expected when a child is grieving, I want to go over, so when do you get additional support? When is this something that might need some professional intervention or just additional supports outside of what we've talked about? So signs to look out for: anger or aggression that's more destructive. So obviously anger can be a big part of grief sometimes, but is it becoming more disruptive? They're not being able to redirect it. It's a little bit more uncharacteristic. Difficulty bouncing back after tantrums or arguments. They really can't shake it afterwards. They're lasting all day. They can't stop thinking about death. So even though it can be normal for death to become much more of a topic, it might be in their play or their conversation, when it comes up, you can't ever get them away from it. It's just this thinking about it 24/7, very difficult to redirect. The grades are dropping, and they're dropping consistently or significantly. Again, after a loss, if the child's not going to school as regularly, or they're still figuring out their plan and getting readjusted, sure, there might be some assignments they're not doing as well on. Some grades might drop during those periods. But if as time goes on, those grades are continually dropping, even with a plan in place, an adjustment period is over, that can be a sign that some additional support is needed. Risk-taking or self-destructive behaviors are always a sign that there might be some more support needed. frequent nightmares and sleep problems. So there's changes in their sleep, but now they're not sleeping ever at night, and it's frequent daily or every other day nightmares. And complete avoidance or refusal to talk or be reminded of their loved one. So while this could be a reaction that happens soon after, if even in the months and months following, anytime someone mentions their loved one, they walk out of the room, they have a big reaction, and they can't tolerate any reminder or conversation with their loved one, might show that they might need some more support. And of course, parents know their child best. So if you're noticing something in your child that's worrying you have questions about, and is uncharacteristic, please follow that instinct. Reach out, and we'll talk about who you can reach out to, but reach out even if it's just to ask questions. I'm noticing this. What does this mean? And really, we want to be looking for any of those typical grieving behaviors that are happening with concerning frequency, intensity, duration, or impact on functioning. So the key here is we want to employ additional support if these emotional and behavioral changes are impeding daily functioning. So the child is not able to get through day-to-day events, tasks, responsibilities, just even the things they enjoy because of how disruptive or debilitating these emotional and behavioral changes are for them. So that could look like ongoing irritability, especially if it's coming with thoughts of wanting to die, less so these thoughts of, I just really want to be with dad, and more so, I can't take this anymore, and those more suicidal thoughts of wanting to die. Significant and ongoing social withdrawal. So for a longer duration, even outside of just initial adjustment period, they are not willing to go to soccer practice anymore. They are wanting to drop out of art club. Their friends are calling to spend time with them and coming by, and they're refusing to see them. Or just really severe separation anxiety, an ongoing fear of being alone. They cannot take when someone leaves the house. If a parent has to go do errands, they have to come with, or they have a big emotional reaction. That can be a sign for some more support. And so if that is happening, there's a couple different things you can do. And so we want to consider what the community supports that are available. The first one I always recommend is letting the school know. Again, your child's at school for many hours a day. And there's a lot of natural supports built in there through friends and through teachers and other positive adult relationships. So sometimes it's helpful, especially if it's something around grades are dropping, they're not wanting to go to school, they're not wanting to participate in their activities, seeing, is there something that needs to be adjusted to their plan? What needs to happen at school for them to feel more supported? Do they need some check-ins with the school counselor, school social worker, or psychologist? The school can also provide referrals too. Sometimes some schools have other children who have gone through a loss, and they can do grief groups and connect kids to other kids who might be able to relate on their grief, or they'll be able to provide referrals for other community supports. Consider connecting your child with a community therapist. So if your child is currently seeing a therapist or has previously seen one, reach out to that person. With kids of all ages, established relationships will always be more effective than introducing a new person, someone they've already met, they might already have some trust and rapport built with. Those are going to be the first places you want to look to. If your child needs additional support, but they haven't been connected with a community therapist previously, I will share some local organizations that provide grief support. And you can also not only talk to the school, they can talk to your child's pediatrician, and receive referrals as well. And I can show you some of the local organizations that can provide referrals if you need something outside of what services they provide. It is always important to know what to do if your child expresses thoughts of self-harm or suicide. So I do want to take a moment just to share what that crisis support looks like. This is definitely a sign of concern, and absolutely will need some type of community intervention. So if your child is expressing thoughts of self-harm or suicide, please seek out immediate support by going to either the nearest emergency room. You can also utilize the Maryfield Crisis Response Center. And now calling the National Suicide Prevention Lifeline. It used to be a much longer number, but now you can just call 988, as well as some of those other resources. So going into where are some of these places you can get more information outside of what maybe I covered today, as well as if you're looking for those additional supports. So there are some amazing organizations that put together information about not only pediatric grief and children who are grieving, but specific loss events that might happen. Again, I kept this presentation pretty general. I really recommend the Doogie Center. They put together amazing resources and activities for children, families, communities. They have a great search function where you can even pick what type of loss event happened. So was it a death from advanced illness? Was it a death from a traumatic accident or violent death? Was it, just a sudden passing? Whatever it might be, you can search. They have resources available in English and Spanish. It's a great place to look, especially if you're looking for maybe an activity to do as a family. They have fact sheets, videos, podcasts, lots of things that can be very comforting or at least provide some additional information. The National Alliance for Children's Grief is also a great resource. They provide toolkits to guide families and communities through different loss events. So kind of step by step of like, oh, this happened. These are some things you can do. Some concrete strategies, activities, things like that. And they also maintain a database of local and national grief support. So in a situation where you are looking for a community therapist or a grief therapist, this can be a good place to look. You can look by location and find what areas near you provide grief support. I also wanted to highlight the Coalition to Support Grieving Students. They have a ton of information focused on how we can support children who are grieving so that they can succeed in their academic setting. This is not only great for our community members who work in schools, but it's also great for parents to take a look at to find out what can I see what the school can provide for my child? What are some ways that I can collaborate and coordinate with the school to provide them a plan that works for them? Of course, I wanted to highlight some resources for more specific instances of loss. For death by suicide and suicide loss, I wanted to highlight the Alliance of Hope and SAVE. They're both organizations that have resources and support for going through a loss by suicide. And they have information about kind of more ways to engage children in that conversation, as well as just more education if that is something that you're wanting to learn more about. And also for child or sibling loss, there's some specific considerations there, some unique nuances. So I wanted to share some places to look for more information in those cases. The Compassionate Friends is a network throughout the whole country that provides support groups and resources for families who have lost a child. And so when you go to their website, you can search by zip code and find the support groups near you. And the Miss Foundation also provides specific resources for child loss as well, including kind of how to engage with your children about the loss of a sibling or a child that they know. So before this presentation, you were sent some of the resources that I have, including our book list. I really think books are a great place to start when engaging in conversations about grief and loss. So I just have some examples of some of my favorite books that I recommend to families up on the screen, but there's many more to choose from. Some of you who maybe have gone through a loss of someone in your life might actually notice the invisible string. I feel like that is a really common one. I keep copies to hand out to families, and a lot of times I hear, oh, actually a neighbor gave it to us, or someone from our church gave it to us, or the school gave us a copy. It's a really great book. It doesn't talk about death specifically, though it does mention situations that could include death, but it just focuses on that feeling of when we're separated from someone we love and we won't see them. How can we keep that connection? How can we feel close to them? There's also some books, if you're worried about talking, maybe you do have like a much younger child, like a toddler, and you're worried about the language you're going to use. There's some books that really will guide you through the conversation. So something very sad happened. I really like that, recommending that to families with younger kids. Each page will go through exactly the language I talked about today of, this person died, their body stopped working, those really biological explanations, but they have blanks so that you can input the person in your life into kind of the script with visuals and things that help explain it to children. There's also resources out there if your child is on the autism spectrum or needs a little bit more concrete or simple pictures. I Have a Question About Death provides like a social story about death, which is really great. And for teens, The Next Place and Where It Is Normal When Teenagers Grieve Really what I recommend when you want to engage your teen in some type of book or content around grief. Sometimes if you bring that book to them and say, hey, I want you to read this book, it's about grief, they are going to go, absolutely not, as that very teenage response. And so instead, sometimes you get these books and you just put them in the house, have them around. And if they come across it, they might feel curious and might engage with it. And sometimes that allows them to have that time to self process and understand and engage with that conversation on grief. And maybe that will open up more conversation. But there's many more books on that resource list, including books for parents and families and communities that you can recommend to others as well. I also provided the list of resources and camps in the area for peer support. So I just have the list of the ones that are local here, but have some more information on that resource that was in the email. All of these camps are free of charge and all have locations that are nearby. Some of them might be more focused, for instance, Camp Kisum is more focused on losses related to cancer, while the other ones are open to other various loss situations. Can't Forget Me Not is with the Wentz Center, which I'll talk about in a little bit. Point of Hope is with Capital Caring, but these all have local locations. And sometimes these peer supports, children don't want to talk to someone one-on-one, especially not maybe an adult one-on-one about their grief, but they can really benefit from meeting other kids who have gone through loss or grief. There are some kids that they won't know anyone in their class or school who has gone through it. And so connecting them with others that have makes them feel, oh, I'm not alone. This is not just something that's happened to my family. Some local resources for grief, like what I just mentioned, the Wentz Center. They're located in Washington, D.C., and they provide individual and group therapy for grieving children and adults. They also have a specialized focus on families impacted by traumatic deaths or violent deaths. So they can be a great resource for that. And they accept most major insurances. Also locally, we have Haven of Northern Virginia. They typically are more oriented towards adult support, but they can be a great place for parents and caregivers to get support so that they can engage in their own grief as well. Capital Caring, which some of you might be familiar with, as it provides hospice care in the area, but they also have a wide range of grief programming available that you do not need to have used their hospice services to engage in. And they also host family-oriented and pediatric groups periodically throughout the year, including the Point of Hope Day Camp. And then I will take some time to talk about Life with Cancer, which is where I come from. And so Life with Cancer also completely at no cost provides education, wellness, and emotional support to patients and families affected or bereaved by cancer. And so we do have a pediatric program that provides individual and group support for children who have lost someone to cancer, as well as other situations that are related to cancer. We have 2 locations in Fairfax and in Leesburg, and provide telehealth as well. And of note for grief, we provide grief circles for different age groups throughout the year. So we do grief circles for teens, middle schoolers, elementary schoolers, which is an opportunity for kids to meet other kids who have lost someone in their family to cancer. And so if that is a situation that has impacted your family, you can reach out to us via our Connect line or our email at lwcpeds@inova.org. So we are wrapping up the informational section of today's class. So I just wanted to summarize the kind of key takeaways that I'd like you to walk away from today with. First, practice that self-compassion. These conversations are difficult, and it is okay to show emotion. It is okay for it to take time. It is okay if you start the conversation and you go, you know what, I want to have a do-over. I don't know if I explained that the way I wanted to. You can be open with that with your child. Say, you know I explained it this way. Can I give another try? I'm going to explain it in a different way. This is not an easy process, and it's okay for there to be ups and downs. Honest, age-appropriate communication about death and dying is encouraged. Using that concrete language, being clear, being honest, telling them when you are, as soon as you're able to, will really help open up that line of communication. Some changes in behavior and mood are to be expected. Not every change you notice is going to need professional attention. And remembering that Grief is a normal human experience, and it's going to be hard, and there's going to be moments of ups and downs. And if your child is experiencing significant challenges that are impacting daily functioning, so the way that their grief is impacting them is keeping them from doing their daily tasks, engaging in activities they want to engage in, that's when they might benefit from additional support. So we'll now have our Q&A section. So again, as a reminder, just keeping your questions general so that we can respect your family's personal information. And if there's a question we don't have time to get to today, I know you can reach out to the Parent Resource Center, or if it's related to anything I've talked about, you can reach out to me as well.
Gemma, thank you so much for sharing all these resources. We have a lot of great questions that have come into, and we're thankful for the ability to follow up later if we can't get to it today. So one of the questions was how to answer questions like, how does a person get to heaven, or other specific questions like that.
Yeah, so kind of more, just so I understand, more like faith-based questions.
And where do they go after? Yes.
After, of course. And so I think the answers are going to be really dependent on whatever your belief or faith system is. I really encourage, if that is something that's going to be language shared with your child, reaching out to your church or your faith community members, talking with, if you have, your church leaders, your faith leaders, priests, pastors, rabbis, imams, people who can maybe inform a little bit of how you can handle some of those conversations. Those can also be times where there's going to be some questions they'll come up with about the after that you might not know the answers to. And maybe there's not going to be a clear or concrete enough answer that's going to make sense to them. So even some of those faith-based answers that might exist for younger children, it might not be satisfying enough. They are so concrete and they want to know, what will it look like? What timeline? I want to be able to know. And that might not be possible. And that might be a situation of saying, these are such great questions. Let's write them down together. Let's see what we can find out, or I'll ask and try to help find out. But, I think some of this we might not know the answer to. And I might not be able to give you that answer. But sometimes in these situations, I've had families benefit from even just letting their child explore, especially if they're younger. What do you think it looks like on that side? You want to draw a picture of what you'd like to imagine your loved one doing right now. And so redirecting them to something that might feel comforting can be a way to navigate those really difficult questions as well. So for kind of more concretely engaging with your church and faith community, helping navigate some of those answers. But if it's not quite satisfying for your child due to where they are in age, just redirecting them to a comforting activity, letting them explore and say what maybe they are hopeful for their loved one to be doing right now.
Beautiful. Another question is, do you have any suggestions for how to address the anniversary of the loved one's death, especially when it happened on a special date? So, for example, a child's birthday, a holiday, or otherwise a significant event.
Yes, that's such a great question, because unfortunately that situation does happen where something like the anniversary of a death lines up with something that was a happy time or was associated with happy events. For anniversaries around death in general, I recommend that just being something that's discussed as a family, and not having any requirements either way. In a family, there might be some members who want to do something. They want to celebrate that person. They want to spend the day doing something. And there might be family members within the same family, same household, that don't want to engage. So I sometimes suggest having that option. For example, some families really like to visit maybe a gravesite on those days, while some family members don't want to. And so providing an alternative for those who want to come, and we'll do this. For those who want to stay home, you can have either an alternative activity, or if they just choose not to they don't want to do anything, that's okay too. And for some families, that can be an opportunity. Again, that concept of continuing bonds. It doesn't necessarily have to be this. Of course, there might be heavy emotions associated to it, but it doesn't have to necessarily be a day of like heavy mourning if that doesn't feel right for your family. Was there a favorite activity that your loved one used to do? Maybe I've heard of families if the mom loved a certain restaurant, they go and eat at that restaurant on the day that she died. Or if there was, they loved do art or music, they go and see a show or listen to music or a concert on that day. So if sometimes there might be something that's a joyful activity that allows them to feel connected to their loved one, can be a way to handle those events. For when it lands on a day that has another meaning, for instance, does happen, maybe it's a birthday, I would have a conversation with the child or the person whose birthday it's on and say, I know that this sad thing happened on your birthday. I also want to acknowledge that it's still your birthday. Do you want, while we're celebrating you, for us to have a point in the party or whatever, the dinner, where we say something about dad or whoever might have died? Or would you rather maybe on the day before, the day after, we have time to celebrate our loved one, and that way your birthday can stay just about you that day? So giving that opportunity, because sometimes what a child might feel is like, oh my gosh, will my birthday never be my birthday again, because this is going to be associated. And of course, there's no magical way to separate the two, but saying, okay, if you want your birthday, we're just going to focus on you today. And then tomorrow we're going to do something for dad. So that way they feel like they have their birthday protected. You can share that with your community members, your supportive family and friends, saying, hey, I know that this happened on the same day, but we really ask that we keep it focused on our kiddo today, and then we'll have something the next day. You also might have a child who goes, no, I want to incorporate both in the same time. Can we blow out a candle for my birthday and then we can light a candle for mom, and having a way to kind of combine the two. Those things, while it never gets easier, each family member will find the way they want to navigate that as time moves on. But definitely that first one can be really challenging, and it might be a bust. Whatever plan happened might not feel right. And that's okay to say, you know what, I think maybe we'll try something else next year because this didn't feel like it really hit what we needed. It's okay for some trial and error to happen because there is no roadmap. And those are really difficult situations.
That's really helpful. And again, if you need to reach out for specific situations or support, those were some incredible suggestions from Gemma. And then we as a team are also happy to help. Another fairly specific question that I think might be helpful for others is how to address questions about cremation without making a young child's fears worse.
Yes.
So it can be pretty scary to learn that the body of a loved one will be burned up on purpose. Any help explaining that to a young child so they're not, just even more scared by that, while also honoring the suggestion to use correct terminology is appreciated.
Of course, that is such a great question. We get that one often because cremation, that's something also that many kids haven't really heard of before unless they've been introduced to it through a situation with a loved one. One way that I have found, I try to avoid burned and kind of more of fiery language, I guess, is another way to kind of put it. So saying, after someone has died, their body's not working, their body's not breathing, all of those things. And so it's just their body. The person and that we know is not in the body anymore. It's just their body. It's not working. They can't feel pain. They can't experience fear. They can't experience anything. It's just their body. And it gets put into a room that gets really hot, and it turns the body very slowly, because of how hot the room is, into ash, which is kind of like dust. And that dust is going to be that person's body. But our loved one is not going to be scared. They won't feel pain, and they're not in their body, so they don't have to experience that. And so I kind of focus on just like the heat of the room to try to avoid the burning questions, because that comes into like imagery of fire, and that's not how crematoriums work either. And so I just focus on the heat, explain what an ash is, and then we're redirecting to there's no pain, there's no fear. You won't see it. So the next time you'll see the urn, and kind of then you just redirect to what will that look like for them. Of course, I can't promise that there won't be difficult follow-up questions or other emotional reactions. Sometimes that's natural, but I do find that is the way I, and at least my professional experience, have helped children at a younger age understand and not be as fearful of the actual event of cremation. It still might be confusing to them because that sense of my person was a person in front of me and now they're in this urn still might be a little bit hard for them to understand. And that might be something that as they get older, part of that re-grieving, they'll process and understand and might have more questions of how that process works. But as far as just the technical language, I usually just explain that the body gets put into a really hot room. And over a very long period of time, the body turns into dust or ash. And then that is put into an urn so that way people can visit with them and have them nearby, or that will get spread into a location that person loved or whatever the situation might be. So I hope that's helpful. I know that's a very intimidating conversation to have.
That's very helpful. Another question was, how can we best help our child when they might be stuck in a regression behavior or, we're going through our own journey and that's challenging for us?
Yes, I know. I think regression is one of those things that can be very frustrating for parents, especially those regressions like bedwetting and potty training, where I know that parents work so hard to get through those milestones and then to kind of be back can feel really frustrating, especially when you're going through your own grief process. I think having those mantras in your head of patience and that it is a snapshot in time, that we do see most cases children get out of that regression with time. If they do feel stuck, that is sometimes a good indication of maybe some additional support is needed. Kind of going back, when I work with parents going through this, you kind of go back, what helped the first time they potty trained? Going back to those basics. What are some of the things that might be triggers? Are they sometimes using the bathroom? Or are they sometimes not? And that's just using the example of potty training, but trying to figure out triggers. Are there certain periods of time? Are they only bedwetting when, on certain periods of time or when certain caregivers are present? Trying to kind of figure out, is there a trigger? Is there a response that this is happening? As well as relying on whatever was successful for you in the past, so that might have a chance of being successful again. But if it really is ongoing, I do recommend that it might be a time to reach out to some additional support, because maybe if they're able to find other ways to either process or understand their grief, little ways that they can kind of contain those feelings of grief, sometimes we'll see that regression go down. I will say most of the time it goes away with time, and that can be hard. And just having that patience, having a supportive family team that you can tap out if you need to. So having conversations with your partner or other friends, family that are nearby that can support your family of when those moments where you're like, I'm feeling really frustrated and burnt out from this, having someone you can also really rely on and get support from. I will say a lot of these organizations that I talked about, including Life with Cancer, we will do parent consultations. So if there is a specific behavior that's like, oh my gosh, like I don't know how to get through this, reaching out to the professional supports, even if they won't work with your child directly, but they might be able to give you more specifics depending on duration, what the behavior is, and things like that.
Thank you. Another question is on separation anxiety. So a child having difficulty when someone's going on a trip, and being scared of that.
Yeah. So depending on the age, I have a couple different strategies that I have seen work really well with families. Some books, like this Invisible String is a great one, as well as The Kissing Hand is a favorite of mine for separation. Kissing Hand, I think, is literally about kind of a parent going away on a trip, it's just, family of animals, but they talk about little practices they can do of kissing their hand to be a reminder of their person that might be on a trip. So they're now, even though they might not be having separation anxiety tied to this person that they lost, but now it's being transferred to any time a caregiver or preferred person is out of the house. Finding little rituals you can teach to your children of, when we call at night, there's a certain thing you guys share, you read over the phone. When they kiss, in that book, particularly they talk about kissing your hand. If you kiss your hand, I'll kiss my hand. I'll feel like we're with each other. Things like if a child's really struggling with it, and especially if that parent has to travel a lot, we recommend sometimes buying like a little stuffed animal that you get two of. The parent has one, the child has another. So when they FaceTime or call or at night, they can hug their animal and see that their parent is also hugging like the same stuffed animal. For younger kids, it kind of provides that feeling of like, oh, we're doing something together, even though there's that distance. So sometimes it replaces that part in their brain of like, I need that touch. So those are some like concrete things that can happen, as well as giving them other ways that they can communicate. If that parent has to be out of the house for a little bit, can they make, every time they have something special they want to share with that person, but they're getting frustrated because that person's gone and they can't tell them, having like a whiteboard or something that's accessible to them that they can write all the things down, or we can be like, oh, that's a great thing, we will tell mom when she gets back, let's write it down on the board. That way they're getting like a replacement behavior for what really they want to do, at least in terms of being that separated from caregivers. And just kind of depending on your child, again, separation anxiety is something that typically over time we'll see decrease, especially if it's happening around school. I would definitely recommend engaging with the school about that, and they could maybe help with some different strategies to help them stay in school. We see that a lot after a loss, that children might want to go home early because they worry about the people at home. They're worried something will happen while they're at school. And so that's a great situation to coordinate with the school if that's the setting where it's happening.
Thank you. And the last question is it okay for kids to sleep in a family's bedroom, or to ask someone in the family to sleep in their bedroom
Mhm.
to help cope after a loss?
So yeah, that kind of co-sleeping, we see that often. I think it can be a really natural instinct of kids. They want to feel that closeness. I definitely, when I have conversations with families where this is coming up, if that is bringing comfort to the child and to the caregiver, if that is something that feels right and feels comforting, I think it's okay to do that. I wouldn't say these one of those situations where I wouldn't say it's all wrong or all right. I think the most important question to ask is like, is this comforting for everyone right now? While being aware that sometimes when you introduce something like co-sleeping and sleeping in your room, there might be a transition period, as that might not last. I will say a lot of times what I hear from families is maybe, because sometimes that even happens with older kids, like teens, they're finding that their teen is kind of slipping into bed with them in the night for comfort. And then over time, they kind of stop coming. And so sometimes that's just a brief adjustment period that might happen. And so if it feels like it's going to be comforting for the child, comforting for the caregiver, it's something that's possible. And if you haven't had necessarily issues with co-sleeping in the past, if it's going to end up something that's going to be more distressing, because maybe you had issues with a child not wanting to stay in bed or needing someone to be with them, and now they're requesting that again, if it feels like you're going to be opening the door that's going to lead to more stress and distress, then maybe that wouldn't be the most appropriate step for your family. But if that hasn't necessarily been a historical issue and it feels like it'd be comforting, I think in times of grief and loss, that can be very healing, while just being aware that maybe there'll be a transition period. But I do find that, especially if kids are coming into the parents' or caregiver's room, that they kind of stop coming after a little bit. They start sleeping more soundly, and it doesn't become as much of an issue over time. So I know that wasn't quite a direct answer, because I think it really depends on each family. But I think if that feels right, I don't think there's anything wrong with that type of connection and support, if it's going to be comforting for both child and caregiver during that acute grieving period.
Thank you, Gemma, so much for this presentation and all of those answers, and to you all for showing up, for continuing your journey of processing loss and seeking more information to support your families. And as you may have gathered from the way that Gemma answered these questions, there is a lot of room for interpretation and personalization within all of this. And there's also a lot of support to have that personalized information and the ability to process what might be best for you and your family. So we do hope that you'll reach out to us or to some of the organizations that Gemma has mentioned, including Life with Cancer, if that's appropriate. And we will be sending out these resources and the recording of this later. And if we can help in any other way, please do reach out. Thank you again. And we do hope that you have a good rest of your day. And if this has triggered anything or you would like to process more, please don't hesitate to take the opportunity to do some self-care. And it is never too late for support or a therapist or any additional information and resources. Thank you all so much and take care.